The NCLEX is changing in 2023, and nursing students and nursing instructors all over the country have been left in a state of limbo, not knowing exactly what's coming, how they can prepare, and where to find resources to help them feel prepared for this huge change in the nursing education industry. What's up, guys? I'm John Haas, RN, founder of nursing.com, and over the last year, I've been talking to thousands of nursing students and nursing instructors about NextGen NCLEX, their fears, and what they think they can do to prepare. And in today's video, I'm going to share interviews with 4 nursing students talking about some of their fears, their strategies, and exactly what they're doing to prepare for NextGen NCLEX.
Honestly, I get, great reviews from all of my clinical preceptors. They like what I work, they like how I work. The patients are very responsive to me. It's just when I sit down for that test, it just all goes out the window.
There's so much fear around NextGen, and it's frustrating that it all comes down to that one test, right? Because you can have all the knowledge up here, you can be great on the floor, but if you're not a great test taker, you're being kind of blocked from doing that, and that's unfortunate. It needs to, ideally, someday we get to this point where it's more clinical based, NCLEX, and you can show that you know your stuff.
I think right now my biggest hurdle is the unfamiliarity with the actual way that they're asking the questions, the type of answers that they're looking for. And so now with the next gen, it's almost like, okay, I haven't even gotten used to the first gen. So.
Probably the unknown. I've heard just like some rumors from different people of what they think it's going to be. Some that had pilot questions on their NCLEX. So just the unknown, I guess.
These organizations that make study guides, I don't think they have an insight of what the NextGen NCLEX is. So it's kind of like, oh, what do I study? Do I study the old things, or like where do I get my resources to study for this NextGen NCLEX?
Just a lot about, what the heck this is going to be like, because there's not a lot of practice material out there with the new NCLEX.
Being one of the first ones to take it, that kind of adds to the unknown.
I don't know if other people can relate, but I feel like we're the first to take the NextGen NCLEX, and I feel like we're more of like the trial and error type of generation where we don't know what's going to happen. We don't know what the test is like.
The scoring for it just is like a big question mark of, is it all or nothing, or are they going to be kind and, not make it all or nothing?
Case study questions do help a lot with preparing you for clinicals and the things that you see in real life. So that was helpful.
But I think what you guys do is just overall, like the practice questions, I think that's honestly the most helpful.
Example questions, study guides for this NextGen NCLEX, that is something that I would find very, very helpful, and I would be very appreciative for.
And of course, nursing.com offers countless questions, and the SIM NCLEX, which I want to take after I read a little more of the content reviews that you guys have, but I do have my book, and then take it and then see what I need to work on, continue to take it until I finish my nursing program. Starting nursing school is when my anxiety really got bad. Test days, I would get out the car and just start shaking for no reason. And I, tried to keep a handle on it using my own coping skills, positive affirmations, listening to soothing music, things like that. But I do think that with the NCLEX, anxiety is a huge factor, and I feel like a lot of people do struggle with anxiety, or it's heightened when they do enter nursing school. So having some tips to say, hey, this does impact your test performance, because I didn't believe it at first. I was in doubt, like, no, I'm just, I'm not studying the right way, something else is happening. But I do think overall anxiety did play a huge role. And if you don't get a handle on the type of questions that you're answering early on, it could just kind of be like a snowball effect.
I don't know if other people can relate, but I take a minute to take an exam. So on some of the exams that we get right now, they do kind of incorporate like case study type of questions, but it's maybe like 2 or 3 in the entire exam. So like in this NextGen NCLEX, they said that it's very heavy on case studies, and I'm like, how long is it going to take me to take this exam? And like, you take the 75 questions, and like you just don't know how long you're going to take. Like, do you have enough time for these big questions to read? Regular college, like let's say you're going for a different profession, their kind of exams are different than nursing exams. Because you have to put in the critical thinking part into your exam, into your taking your exam.
We've been doing a lot of those like practice questions at the end of the HESI exams, which are very intimidating when they pop up and it's that big drag and drop chart.
I think for the most part, nursing.com has a lot of resources that I could use that help. I can customize my study plans to exactly what I'm learning for that lecture. And so when there are times where mentally I feel exhausted and I don't want to read, 40 pages, I can go to nursing.com, I can look at the outlines provided under the video, I can watch the video, and if I have any further questions, I'm like, okay, this seems like something that I need to get further information on, I can do that by looking through my books. And I feel like it just cuts down on a lot of the mental chatter that goes through your mind of how do I approach this topic.
All right, if you found this video helpful, head over to nursing.com where you can get started with free NextGen resources. Just go to nursing.com and get started right there. If you want more content like this, hit the subscribe button. And as we always say here at nursing.com, go out, be your best selves today. Happy nursing.